Imagine waking up one day with a small tingle on your skin. It starts out as a mild itch, something you could easily ignore. But then, over the next few days, it becomes a painful rash that spreads across your body, bringing blisters and discomfort. What you might be experiencing could be shingles, a condition caused by a virus that nearly 95% of adults already carry inside their bodies. But what happens when this rash becomes widespread, potentially covering your back, chest, and even face? That's when we're dealing with something more severe: disseminated shingles. Shingles isn't just a minor skin irritation. It's something that can bring real pain and health risks, especially when it spreads across multiple areas of your body. And here's the scary part: for some, particularly those with a weakened immune system, shingles can get much worse, leading to life-threatening complications. What exactly is disseminated shingles? Let's break it down. We all know chickenpox, the itchy spots we get as kids. The virus responsible for that, called the varicella-zoster virus, never truly leaves your body. It hides out in your nerve cells for years, even decades, only to come back later in life as shingles. Normally, shingles sticks to one area, often following a path along your skin that corresponds to specific nerves. This area is known as a dermatome. But what if that rash refuses to stay in one place? If more than 20 blisters appear outside of the initial rash, covering multiple areas of your skin and crossing the body's midline, you've likely entered the realm of disseminated shingles. This means the virus is no longer contained, and it's starting to spread like wildfire. Who's at risk? Here's the thing: anyone who's had chickenpox is already at risk for shingles. And while that might sound alarming, not everyone develops the severe, widespread version known as disseminated shingles. The real risk factors: age and immune health. Once you hit 60, your chances of getting shingles skyrocket. In fact, about half of all shingles cases affect people over 60. If you're over 70, your risk is even higher. Why? As we age, our immune system weakens, making it easier for the dormant virus to reactivate and cause shingles. But age isn't the only concern. People with compromised immune systems, like those undergoing cancer treatments, living with HIV, or even taking medications after an organ transplant, are much more vulnerable. In these cases, the body struggles to keep the virus under control, and shingles can quickly spread, turning into disseminated shingles. In fact, 15 to 30% of people with weakened immune systems who develop shingles will see it progress to the more severe disseminated form. Why should you care about disseminated shingles? The complications from shingles aren't something you want to ignore. With localized shingles, the virus typically stays in one area, causing pain, a rash, and possibly scarring. But when shingles becomes disseminated, the stakes get higher. This is where the virus moves beyond the skin and can potentially lead to serious complications like encephalitis, inflammation of the brain, or pneumonitis, inflammation of the lungs. The pain from shingles can also linger long after the rash disappears. This condition, called postherpetic neuralgia, can cause months or even years of severe discomfort. Imagine trying to go about your day with a constant burning or shooting pain, even though the rash is long gone. That's the reality for many people who develop shingles. Recognizing the symptoms. So, how can you tell if you or a loved one might be facing disseminated shingles? It starts with the classic shingles symptoms: an itchy, tingling, or painful rash that develops into fluid-filled blisters. But unlike regular shingles, disseminated shingles isn't confined to one area. You might notice the rash covering larger parts of your body, even crossing the midline, meaning it doesn't stay on just one side. You could also experience flu-like symptoms such as headaches, fever, and sensitivity to light. And for those with weakened immune systems, this form of shingles can spread internally, affecting organs and causing even more severe health problems. How is it treated? Here's the good news: disseminated shingles can be treated, but timing is critical. Antiviral medications like acyclovir are the most effective when taken as soon as possible after symptoms appear. The faster you act, the better chance you have of reducing the severity and spread of the virus. For people with a weakened immune system, the situation can be more complicated. Treatment might require hospitalization, where doctors can administer antiviral medication through and for to get the virus under control more quickly. Pain relief is also a critical part of treatment, as shingles can cause intense discomfort. Doctors may prescribe stronger painkillers, like morphine, to help manage this. And once the initial treatment in the hospital is successful, people can often switch to oral antiviral medication and continue their recovery at home. Why prompt action matters. If you think you have shingles, especially if you're at higher risk due to age or a compromised immune system, it's crucial to see a doctor right away. Antiviral medications are most effective when taken within 72 hours of the rash first appearing. Waiting longer could allow the virus to spread and increase the chances of serious complications. Think of it this way: shingles isn't just about a painful rash. It's about protecting yourself from potential long-term nerve pain, serious internal complications, and an extended recovery process. That's why early diagnosis and treatment are key. Preventing shingles and disseminated shingles. You might be wondering, is there anything you can do to prevent shingles from ever happening in the first place? Luckily, there is. The shingles vaccine is a powerful tool that can significantly reduce your chances of developing the condition. The CDC recommends it for anyone over 50, even if you've had shingles before. The vaccine not only lowers the risk of getting shingles, but it can also help prevent the more severe, widespread form of disseminated shingles. But prevention goes beyond just vaccines. Keeping your immune system strong is another important way to defend against shingles. That means maintaining a healthy lifestyle, eating well, staying active, managing stress, and getting regular checkups. The bigger picture. While disseminated shingles is rare, it's a condition that can have a serious impact, especially for older adults or those with weakened immune systems. The key takeaway. Shingles isn't something to ignore, and disseminated shingles can take an even heavier toll on your health. So, if you or someone you care about is dealing with shingles, don't wait to seek help. The sooner you get treatment, the sooner you can manage the virus and lower the risk of complications. Shingles is a battle you don't want to face alone, but with the right medical support, you can take control of your health and prevent the virus from spreading even further. Conclusion. Disseminated shingles may sound intimidating, but with the right knowledge and quick action, it's something that can be managed. Remember, if you've had chickenpox, the virus is already inside your body, and it can reactivate at any time. Know the symptoms, understand the risks, and don't hesitate to contact a healthcare professional if you think shingles, or worse, disseminated shingles, could be affecting you. Stay informed, protect yourself, and take action early to avoid the pain and complications that shingles can bring. Because at the end of the day, your health and well-being are worth it.